I'm Dr. Ghulam Fatima. In previous lecture, we have discussed about the bronchial tree in detail. Now we will discuss about the lobes of the lungs. As you can see in the diagram, there are 3 lobes in the right lung and 2 lobes in the left lung. We have already discussed that trachea divide into the right and left bronchus. Right bronchus is clinically more important because it is wider, shorter and vertical, and because of all these characteristics, any aspirated foreign object can dislodge or pass easily through the right bronchus. But what is the location where it will dislodge depend on the position of the body. For example, in supine position, inhaled foreign object will enter in the right lower lobe, while if the patient is lying on the right side, inhaled foreign object will enter in the right upper lobe, and if the patient is in the standing position, inhaled foreign object will enter in the right lower lobe. These are the different positions where the foreign or inhaled or aspirated foreign body will dislodge because right bronchus is wider, shorter and vertical. What is diaphragm? Diaphragm is dome-shaped muscular and membranous structure. It is the principal muscle of respiration. This one is the diaphragm, having right and left dome and right and left crux with certain openings. There are 3 openings in the diaphragm. First one is the CAVAL opening at the level of T8. Next one is the esophageal opening at the level of T10, and next is aortic opening at the level of T12. In CAVAL opening, not only right inferior vena cava but right phrenic nerve also passes. At the level of T10, esophageal opening or esophagus and vagus nerve pass, and at the level of T12, red, white and blue structures means aorta, thoracic duct and azygous vein passes through the aortic hiatus or opening. You can also see in the diagram that CAVAL opening lies at the level of T8, esophageal opening lies at the level of T10 and aortic opening it lies at the level of T12. Diaphragm is innervated by the phrenic nerve. Phrenic nerve has root value C3 to C5. It means it originates from the cervical level of brachial plexus C3, C4 and C5, and this nerve supplies the diaphragm. As you know, these nerves are present at the level of shoulders, so any irritation of the diaphragm, pain can be referred to the shoulder and trapezius ridge. This is very important, that why pain of the diaphragm or irritation of the diaphragm is referred towards the shoulder, because it is supplied by the phrenic nerve, and phrenic nerve has root value C3 to C5. That is why pain referred towards the tip of right shoulder.